The recording. Perfect, perfect. All right. So again, thank you so much for your patience. This is our 7th webinar in our Security Over Compliance series. We are so thankful to all of you guys for continuing to join in for these webinar series. Today, we are extremely blessed to have Matthew Economy presenting on how to start from scratch. So finding compliance when starting from zero. Matthew Economy is the Chief Security Officer at a critical access hospital up in North Dakota. He also is a team member at a managed service provider. So he has a perspective from both ends, both being from the outside of a hospital and being inside the hospital on the day-to-day. So we're very excited to hear from Matthew. Matthew, take it away.
Great. Can you hear me okay, Sarah?
Yes, sir.
Okay, perfect. Yeah, so good afternoon, everyone. As she said, my name is Matthew Economy. A few months ago, Sarah invited me to put on a presentation, and one of the things that I'm really passionate about is working with people and discussing issues that come up when you are in a situation where your organization does not have a compliance program at all, where you're basically starting with nothing, or you yourself are involved in a HIPAA program, but you do not have much knowledge to begin with. One of the things I want to talk about is this is specifically targeted for smaller organizations, people working with a limited budget and potentially limited talent pool. Some of these things that we discuss will be scalable to large organizations, but they deal with slightly different problems on a slightly different scale. So just keep that in mind as we're working through this whole thing. First thing I want to talk about is a little bit about myself. As she said, my name is Matthew. I was born in Minnesota. I was raised in North Dakota. I spent my whole life in small towns of under 1,000. I went off to college, and in 2015, I joined the IT company. They were called SPAR Technology at the time, and their main focus was rural healthcare facilities, critical access hospitals, and other small businesses in the area providing IT services. We've recently rebranded, and now we're called OK Computer, but we're still doing basically what we did before. 2018 is when I became the security officer. I took over that position at one of the healthcare facilities we were providing services for. And it was at that time that I started my own HIPAA journey. And it's important to note that 2018 is when I took over the position, and 2018 is also when I began educating myself on HIPAA, because before that point, I knew virtually nothing. What ended up happening was in 2018, the OCR, which is the Office of Civil Rights, the OCR is the enforcement branch for HIPAA. They were going around the country and putting on education seminars specifically targeting small hospitals to educate them on HIPAA. And although I was a third-party contractor at the time, the healthcare facility invited me to go on their behalf to learn about HIPAA. And at the time, I had complete confidence that I was one of the wisest HIPAA people in my area. My knowledge of HIPAA consisted of about two things. The first thing was, if you have a hard drive and you're done with it, you need to shred it. And if you're going to send an email that contains PHI, you need to encrypt it. And that was all I knew at the time. And I showed up at this meeting, and within about the first 15 minutes, I was humbled greatly. They started talking about BAAs, they started talking about risk assessments, policies, audits, all these words that I'd never heard of in my entire life. And I started to become very afraid. I was afraid because I realized that our organization, not only were they not compliant, but they had zero compliance with what HIPAA was asking of us. And I also realized that that brought along with it quite a bit of risk to our facility, financial risk, and also risk to the reputation of our organization. So I went back after those meetings and I talked to the administration and explained to them that we had a very massive problem and we needed to address it very quickly. And I asked them if I could be the one that would lead the project. And that's when I took over the security officer position. And so our organization started from scratch. We absolutely had zero compliance with HIPAA, and we were in a world of hurt. And some of you listening to this call might be in the same position. You might be listening to some of these talks or browsing the web and searching other HIPAA things and realizing that there's a lot of things that you don't know that you probably feel like you should know. And that's where we're at. And what we're going to do today is we're going to walk through what we did at our organization to find compliance. We're going to talk about a roadmap and give you kind of a template of what you could do in your organization if you find yourself in the same situation. So the first question is, what does zero look like? What does it look like when you're starting with zero? So this right here is what zero looks like. This is a picture of me in 2018, right about the time that I took over. As you can see, I'm smiling and I'm happy. I look very carefree and oblivious, I would say is a good explanation. And this is me now. It is a massive undertaking. I don't want to underestimate what it will take. It is not something that you do quickly. It is not something that you do easily, but it is something that is very important to do, and it'll probably age you a few years. There's a good reason why I don't have my webcam on now, because it'd probably scare y'all. So, okay. So when I was at that meeting, that education seminar, and they were talking about all these different topics, risk assessments and policies and stuff like that. About an hour before that meeting, I was in a stage where I didn't know what I didn't know. I walked in there thinking we were doing everything that we were supposed to be doing. Our organization sent me there thinking we were doing everything we were supposed to be doing. And I just didn't know what I didn't know. And unfortunately, that's not an acceptable place to be anymore. If the OCR shows up and audits you, you can't just tell them, I didn't know. That's not an excuse anymore. And the fines start coming. So as you were looking at some of these topics, I would consider these the pillars of HIPAA. I would consider them potentially the building blocks of what you need to check the box and become HIPAA compliant. Some of these aspects you might have down in your facility. Some of them you might not. And some of you may find yourself in a situation where you don't have any of this built up. And that's what we're going to go through and teach you how to transition from you don't know what you don't know to now you know what you don't know. And like I said, that's what happened to me when I was at that meeting. Within a few minutes, I quickly realized there was this very large thing out there called HIPAA compliance. And I now know what I did not know, and that was HIPAA. And so I had to change that. I had to begin to learn, and I had to begin to adapt, and I had to begin to understand what it was going to take to become compliant. And because this is the 21st century, I immediately turned to Google. And if you're in that same situation, I'd recommend that is a great starting spot. It is absolutely free. It takes just a few minutes of your time. It's a heck of a lot faster than walking to the library and checking out books. If you have any question, just Google it and you will get at least 1 million answers. What I did is every single word that that speaker brought up, I started putting it into Google, and I just went through my list one by one. And each time I'd find a site that would help, and sometimes I'd find sites that would not help, and sometimes I'd find websites that would help me if I paid them, you know, $300 a month for the next 6 months or whatever their agreement was. But I at least found information. And I began to slowly get my arms around the entirety of what HIPAA actually was. Because when I started on day one, I didn't actually realize how big it was going to be. I just knew it was big and I needed to learn how big. Google is a great way to help you understand how big the HIPAA program is going to be. Another great resource that I use and I'd recommend to anyone is YouTube. Reading is good, but YouTube is a great alternative to supplement what you're learning. Sometimes it's enjoyable rather than reading 3 to 4 pages. You can watch a little 3 to 5 minute animated cartoon that other organizations have built for their own HIPAA compliance programs. It's also easier to share a little 3 to 5 minute video with some of your associates to help them learn rather than asking them to read a 3 to 4 page web page. The other thing I'd highly recommend, and obviously a lot of you are already on this webinar, but I would sign up for every single webinar you can, especially if you're starting off at the point where you know nothing about HIPAA, or if your organization knows nothing about HIPAA. Almost every website you go to, they'll have pop-ups that come up, or they'll say, hey, you want to learn about HIPAA, click here, and then they ask you to sign up for the webinar. I would sign up for every single webinar, and I would watch every single webinar until you're probably sick of them. Because the goal is to try to expose yourself to as much information as quickly as possible, and this is one of the great ways that you can do that. Contacting other friendly organizations is also helpful. Typically, there are multiple other facilities. They're probably competitors, but oftentimes they're quite friendly if you call them and need to ask them for advice. I want to emphasize the word friendly because if you are currently not compliant, or if you have no compliance right now, if you contact somebody that is not friendly and they find out that you don't have anything built at your facility, they could report you, and it could turn around and you could find yourself being audited before you're ready to be compliant. So make sure that the people you contact you can trust, and they're not going to turn around and try to turn you in. When you are doing this, I would recommend to work as a team. It's important to have people from different aspects and different backgrounds. It's important to have different perspectives, and then that way you can share the workload. When you do make your team, I recommend that you have somebody from corporate compliance if you have somebody in that position. I would recommend somebody from medical records being there, and then I would absolutely recommend somebody from the IT department being there. The IT is a critical portion of this because in order to be HIPAA compliant, they are going to have to implement certain regulations into the computers. They're going to have to put certain restrictions on softwares. And if they're not there, you're going to be spinning your wheels for far longer than you should be if you're not currently already familiar with IT stuff. The other option is to don't work with a team. And I would actually, for small facilities, I would honestly recommend that more. I know some people would say that's bad advice, but they always have that saying about you can go faster alone and further together. If you have no compliance program, it is the most important thing to become compliant as quickly as possible to reduce the risk of fines coming to your facility. And that is what I ended up doing at our facility. Is I ended up just doing it all by myself. There were times that I reached out and had questions, or I needed follow-up from other departments. But most of the things I did by myself just so I could get it done more quickly. The other thing that's important about this is you will learn a lot more when you do every single aspect yourself, so that later on, once you are fully compliant, then you will form a team, and then you'll be knowledgeable in all aspects of the HIPAA program, and it will really help you function together. I would say if you're starting it with nothing, or if your knowledge is very limited, I would absolutely find somebody that knows a lot more than you and you can partner with. Typically, these are going to be a paid service. It is possible, and I say possible, to do all the steps above and become compliant, but I would say it's extremely difficult, and it is also extremely risky that you could potentially miss things that still put you at risk, or on the opposite, you're going to do way more than you need to do. And the organization that we teamed up with was HIPAA, which is part of the reason why I'm on this webinar now. What happened was I was watching, 6 or 7 different webinars a week, and somebody knew about that in our organization and forwarded me a pre-recording that Sarah had done at the University of North Dakota called Don't Buy the Snake Oil. And one of the things that I was encountering as I was trying to learn more about HIPAA was with all the different websites giving you all this different information, it was different information about what you actually needed to do. And a part of that is because some organizations will pad what the requirements are so that when they bill you for those services, they can make a lot more money. And what Sarah did in that presentation is she went through many of the things that companies do to try to pad their sales that are not actually necessary, not actually required. And that was one of the main reasons why we decided to pair up with HIPAA. And so I contacted Sarah, and I explained to her our situation, and we started working on a roadmap to try to become compliant as quickly as possible. And this is the roadmap in terms of the order that we targeted all the different goals, all the different pillars of HIPAA to tackle. And in the next section, we're going to go through each one of these and kind of explain why we did them in that order, and then also explain basically a little bit about each one of them. So BAAs are business associate agreements. If you do not have them, the first question you have to ask yourself is, what is a business associate? So a business associate is a person or entity that performs functions on your behalf that involve the disclosure of PHI. Basically what they are is, you as an organization, you generate PHI. And there are times where you need to share PHI with people or organizations, I just refer to them as vendors, outside of your facility. And anybody that you share that PHI with is considered a business associate. So if you have third-party collections, third-party billing, if you have a law office that you deal with legal matters where you will share PHI from time to time, these are all considered business associates. And for every single business associate you have, you need to have a corresponding business associate agreement. What these agreements are is they're a written arrangement that explains the responsibilities that each party has when it comes to PHI. So basically it says, I have PHI, I'm going to be HIPAA compliant, I'm going to share this PHI with you, and you are also going to be HIPAA compliant and take care of the PHI I share with you. And if there's a problem at your end, here's your responsibilities, and if there's a problem at my end, here's my responsibilities. Every single business associate needs a BAA. If you currently have BAAs and you think you're good, you can check off this box. Make sure that you don't have any that are older than 2013, September 2013. At that time, they adjusted some of the rules regarding the responsibilities that business associates have, and you have to have a new BAA, and it has to be signed after that date with the adjustments necessary. Also, if your BAAs are older than 2013, you probably need to review them all anyways, because I'm guessing they would have changed over the years. One of the facilities that we worked with is a 20-bed critical access hospital. We have about 50 BAAs. I would expect that number to go up based upon your hospital size, but those are the type of numbers you can expect to look at. So if you have like 2 to 3 BAAs, you're probably not doing it correctly. One of the other really important steps of BAAs is you need to verify that the business associate is actually compliant with HIPAA. You can't just give them a document, say sign this, and consider yourself good. If you got some guy's cousin that's running a file server and you store all your radiology images on there, and he has a data breach, and he has zero HIPAA compliance, if the OCR shows up, they're going to look at the situation and they're going to deem you liable, and they're going to fine you as well. Because although you had a BAA, you didn't take steps to verify that, your friend's cousin is actually doing a good job taking care of the PHI on his server. The reason why we focus with BAAs first is because when you're sharing PHI out to organizations, you're unsure in theory of what their actual business practices are. And what I mean by that is the organization we were with, we were doing a pretty good job of making sure that the PHI was secure at our facility. And so the chance of a breach was fairly low. Although we still had zero compliance, the data was more or less secure, if that makes sense. We were unaware of all the business associates, what their workplace practices were like. And they also had a higher chance of being targeted. Some of the collections that we were dealing with would do collections for multiple different hospitals, and there would be a higher risk of a bad actor targeting them over targeting us as a smaller facility. So that was the first box we checked, is getting BAAs sent out, getting them signed, getting them put back, and getting them put in our system to make sure that if one of them were breached and the OCR did show up, that would potentially be a small shield to protect us against some of the fines. The next step was the risk assessment. The reason why we tackled the risk assessment next was, from my understanding with conversations with Sarah, is the risk assessment is one of the most powerful tools you can use to protect yourself from the OCR. If the OCR does a routine audit of your facility, oftentimes they will just reach out to you and say, hey, do you have a risk assessment, and do you have your policies? And if you send them to them and they deem them to be appropriate, they will just leave it at that. If they reach out to you and there is no risk assessment, or the risk assessment is incredibly old, then they're going to show up at your door and do a full assessment, and then you're going to have a lot of problems. So the risk assessment is multiple parts, and it's probably one of the largest parts of the entire HIPAA compliance program. It is the most time consuming. It comes in a couple parts. The first part is a questionnaire. So there's a couple different ways to do this. the OCR, they do have a tool called the SRA tool, Security Risk Assessment Tool, and that will give you a list of all the questions you need to go through. At the time, I didn't use that. Sarah worked with us, and we actually had an Excel spreadsheet that I worked through the 400 questions on. But the SRA tool at the time was not that user-friendly. They have updated it recently, and it is potentially something you could look at if you're looking for ways to go through the questionnaire. Some of the questions that they ask you is, do you have unique user ID and passwords for all your employees? Have you established automatic log off for your computer systems? Does your organization maintain an up-to-date list of key information and technology that you use? And you basically go through each of these questions and you answer yes or no. In our situation, I believe 95% of the answers were no, which was bad because obviously we were not compliant, but it was good because then we had a good list of things we need to target to make things right. The next step of the risk assessment is you need to identify vulnerabilities. So a vulnerability for your facility would be potentially like, as of today, if you had a computer running Windows 7, Windows 7 is no longer getting security updates from Microsoft Windows. So one of the vulnerabilities for your facility would be that machine running Windows 7. You then have to identify potential threats for that vulnerability. So if you could say, you know, if we have a malicious employee, they're upset, they know you're running Windows 7, before they leave, they can install some malware onto my machine, and that's one of the threats, and he could exploit that vulnerability, and that's one of the things that could happen. After you've done those two steps, identifying vulnerabilities and threats, you also have to determine the level of risk associated with this. And that's what's really important, is determining the level of risk, because it's not a vulnerability assessment, it's not a threat assessment, you're doing a risk assessment. And the best real world example I can come up with this is, you know, when you're at a gas station and you go inside, if you're living in a small town, you're probably going to leave your car running and your keys in the car. The vulnerability would be somebody could potentially steal the keys and steal your car. If you see a guy standing on the sidewalk, he would be a potential threat. He could exploit that vulnerability and take your car. And you're going to put a level of risk. So if you live in a small town and you see your cousin Bob on the corner, you're going to probably leave your car running and go inside and not think it a big deal. If you go to a larger city, you're probably going to take your keys and you're going to probably lock the door because you understand that there's a greater level of risk to leaving your keys in the car. You're going to be doing this with the same process throughout your whole facility. So if you have a large server and it has old software and it's no longer being supported, the level of risk is going to go up or down depending on if it's connected to the internet, depending on how big of a facility you have, depending upon what type of PHI is on that server. And you give each vulnerability and threat a risk level. The next step is, for every single risk you have to create a remediation plan. You have to basically say, this is the threat, here's the vulnerability it could exploit, here's the level of risk associated with it, and here's what it would take to remediate. So for that server, it might cost you $40,000 to buy a new server and a new piece of software in order to remediate the risk you have of having out-of-date software. One of the unique things about HIPAA, and it's kind of a frustrating thing, is you're not technically required to fix that, to remediate that risk immediately. You do have the opportunity to decline remediation. It's very important, though, that you document why you're remediating it or why you're not going to. So if you decide not to actually update the server, you could say it's $40,000, there's a low risk of something bad happening. We're going to remediate it next year when we can set aside money in the budget to actually make it happen. So that is an opportunity that you have there. On the opposite side, if you say you're gonna fix it next year, and next year comes around and you don't fix the threat, or maybe it's something that is actually highly exploitable, like, you know, you're running Adobe Flash Player on your medical record software server, that would be a high level of risk. There would be no great reason for you to not address it. And if you don't address it and the OCR shows up, it doesn't matter how much you've written on that piece of paper, you're probably still going to get fined. On the other side, if you say you're going to fix it next year, and next year comes and you don't fix it, and the year after that comes and you don't fix it, and the OCR shows up, it doesn't matter that you said, oh, I'm going to fix it next year. If it's been 3 to 4 years since you've addressed that issue, they're still going to fine you. So you can choose to not remediate the risk, but I'd recommend that you have a really good reason why you're not going to remediate it. And I'd also recommend that you set a specific timeline of when you're going to get the issue fixed. Oftentimes when you read in the news and you hear about organizations being fined, one of the things they almost always point out is that this was a known risk that the facility had been aware of and did not address. Oftentimes, if you hear about people leaving laptops in taxi cabs and it wasn't encrypted, if you find out about people have flash drives that they left at their girlfriend's house and it wasn't encrypted, almost always it says, somewhere in that news article, the OCR said it was a known risk and they did not address it and they get fined $1 million. This is that part. So you need to document your risks and document what you're going to do about it, because if you don't, you'll get fined. And if you document them but don't do anything about it, you could also potentially get fined. The other really important thing to recognize about risk assessments, and I kind of addressed a little bit earlier, is risk assessments are fluid and they're ongoing. So the day you finish your risk assessment, and I believe it took us about 6 months to get ours done, from that point forward, your organization is going to go through different changes. They're going to be adding, maybe they're going to add on an addition to the building. Maybe they're going to move people around to different departments. Maybe they're going to remodel, or they're going to be offering new services like telemedicine with the COVID outbreak. As these new risks come up, you need to update your risk assessment and say, hey, we added this new building. Here's some risks that come with this new building, and do the exact same process. The other thing is on a regular interval, you need to go back and do the entire risk assessment all over again. They don't have a specific time frame that you have to do this on. I believe typically they do this every 2 years, but I would recommend not doing it any more than that. If you document and say, hey, I'm going to do it every 10 years and the OCR shows up, you're probably going to get fined. I'd recommend doing it at least every 2 years. So the next thing was policies. And so when we were going through the questionnaire, most of the questions pointed at specific policies. They said, do you have a policy for this? Do you have a policy for hard drive encryption? And that gave us a really good list of the policies that we need to make sure that we had in our system. Now, if you currently have policies for your HIPAA program, that's great. One of the important things is you need to make sure that you review those policies very regularly. I believe once a year is what you're required to do. We have all of our policies in the HIPAA platform, and it sends us an email alert once a year to the correct people saying, hey, it's a year, you need to review these policies and you need to sign off on them or make changes in order to stay compliant. The big thing that I'll say about policies is I would highly recommend getting help. And when I say help, I mean getting paid help. If you do not have policies or your policies haven't been looked at for 10 years, I'd recommend getting somebody, a professional, to take a look at them. It's important that you have all the policies you need, and it's also important that you not spend time writing policies that are not necessary. When we signed up with HIPAA, they gave us templates for all the policies that were required, and we just had to go through and customize them for our own organization, and it made that process very smooth. You can go out and buy books of HIPAA policies, but I'd recommend moving to a digital platform. It'll just make things easier in the future. So then after you have your policies, you need to educate people about what those policies are. You need to educate people about what your HIPAA program is all about. This is something that also needs to be done yearly. You need to train all employees yearly on your HIPAA policies, on your HIPAA program. It's also important to send out security reminders. We recommend doing it once a quarter, sending a security reminder saying, hey, make sure you lock your computer when you walk away. Hey, don't leave any PHI on your desk. Just little things here and there to keep people up to date on what's going on. Posters is also a good thing, so you can just put little reminders all throughout the facility. One of the things that's important about HIPAA is to recognize that it's important to check the box and make sure things are done right, Posters are an aspect of making sure you go above and beyond to make sure people's PHI is secure. Incident training is also very important. If you have a situation where you have a doctor texting his nurse saying, hey, patient to room 141 needs his bedpan changed, that is not an appropriate way to share PHI. And so you're probably going to want to bring the doctors together, and you're going to want to bring the nurses together and just give them a little reminder of, hey, this is how we actually do these things. And I'm going to put the document bullet in this slide here. The document bullet should technically be on every single slide. If the OCR shows up at your door, they don't actually care what you've done. They care what you can prove you've done, and you can't prove it if you didn't document. Document your risk assessment, document your BAAs, document your policies, document every single thing you've done, because if you can't prove it, it never happened. And then audits. We saved audits for the very last. It took us about a year to go from absolutely nothing to getting to this point here. And during that time, we were able to greatly expand our knowledge of HIPAA. We were able to greatly expand what we knew we needed to do. And after we had implemented a lot of these different policies and procedures in our organization, the audits were a great way to go back and review what we had actually done and make sure that it was being effective. So audits you need to perform regularly. That will be determined, the timeline of that will be determined based upon what you're actually auditing. If you're auditing people's access rights, if you're auditing which chart nurses have been in, it's going to change how often you need to do that. Audits will cover many different topics. A big one is like minimum necessary access. So if you have a file server where you're sharing files that have PHI, it's important that you give people access to only the folders they need. And that's something that you're going to want to audit as well. The other thing we do is once a quarter, we do a privacy walkthrough. So privacy walkthrough, we just have a list of questions, and we've taken our organization and broken it down into individual departments, and we visit with every single department and go over a list of questions. And we pick a different individual in each department each time we do it. This does a couple of things. One is it allows you face-to-face time with people where you can actually have a conversation and ask them, how the changes are, if they're being effective, if they're not being effective. You can also physically observe with your eye if they're doing things incorrectly. So oftentimes I'll be places and I'll realize, oh, they're putting PHI in an unlocked cabinet. Or, hey, I see you don't have a locked shred bin. Would you like us to get you one so you don't have to walk across the hallway to do it? Taking little steps to make HIPAA compliance easier for the employees will make the whole program run smoother. It's also really important that you share the results. We put together our HIPAA team after we had done getting compliant, and that's typically where we share our results. This kind of goes along with remediate and improve. We've also tied our privacy walkthroughs to our quality assurance program. So every quarter when we have to report to quality assurance, we will show them a list of our privacy walkthrough so that they're aware of currently where we're at in terms of a score, and then they can see improvement as we go along. So those are the pillars or the building blocks of a HIPAA compliance program. These are the orders that we've done things in. You can do your own order, whatever you feel is the most important to do first, or if you have some of these components but not all of them. And again, I just like to highly emphasize that this is a very, very simplified version of what you need to do. If you're looking for more complex stuff, find an expert, talk to Sarah, talk to someone that knows a lot more than me about this whole situation. The next thing we're going to move on to is preparing your organization for change. Something that oftentimes gets overlooked is you might have a large program or a large plan that you need to implement, but you're not terribly comfortable or you don't really know how to go about making the changes in your organization. And it's important because if you have all the knowledge, but you don't have anybody that's willing to follow you, or you have a lot of conflicts and pushback when you try to make the changes that are necessary, it's going to be frustrating for you, and you'll probably find yourself not being able to fully flesh out and fully realize all these HIPAA compliant components that you've been learning about. So I'm going to go over just a couple of key points that I recommend to people whenever they're trying to implement change. The first one, of course, is communication. When I was at college, I think they made me read at least 100 books about leadership, and every single one of them had 3 to 4 chapters about communication. So we're going to put it on here just for old time's sake, but the main focus I want to talk about is not just communication, but how you should communicate. When there's a large change that we need to make, which HIPAA is a large change, I would recommend, especially if you're in a smaller facility, to go to each individual department or each individual themselves that is going to be affected by the changes that you make and talk to them about it. Explain to them basically what you're going to do, explain to them why you need to do it, and explain to them what will happen if you don't do it. Giving people those 3 bits of information will really help them digest and to accept the changes that's going to be coming their way. The other thing I like to do is I like to bring relatable examples. So if I'm going to go talk to the CEO about why I need to make a change that I do, I'll bring examples of organizations that have been fined massive amounts of money for not making that specific change. Because CFOs really care about money and they really care about numbers. And if you tell them a story that something that they don't do is potentially going to hurt their bottom line, they'll sit up and listen. If you're going to talk to the CEO, I would bring potentially a story about an organization that had a breach and how the CEO had to go out and do news clippings and do press releases and do a town hall and stand up in front of a bunch of people and explain to them that hey Mary, I'm sorry that your PHA got breached, but congratulations on being pregnant. CEOs don't want to do that. In fact, nobody wants to do that. And when you bring them those stories, even if they're resistant to the change, when you tell them that story, they will put themselves in that story, and it makes them really uncomfortable, and it will make them more open to needing to do what you want them to do. This is also a very common thing to talk about change and make sure that any changes that are coming, you talk about that early and often. Very similar to voting, vote early, vote often. Talk about things early and talk about things often. All of the changes that we made at the facility here, we were talking about them at least a year in advance. Every single week we had department director meeting, and I would bring up, hey, we're going to be looking to encrypt computers' hard drives. Hey, we're going to be looking to installing new antivirus. Hey, we're going to have to put 15-minute auto locks on everybody's computer. Even though they're about a year away, I would just constantly bring them up to the point that they were probably sick of me bringing them up. But the goal is to reduce shock. It's very similar to the frog in the boiling pot. If you take people and you just throw this change at them, they're going to be very upset and very resistant. If you talk about it for months and months and months before you actually do it, they'll be a lot less resistant and a lot more open to the changes you need to make. The next step is testing. When I work in the IT department, anytime we need to make a change to software, the first thing we do is we take a computer, we bring it in the back room, and we test it. And then what we do is we go to a small portion of people and we perform the same test on a live system with a small number of people. And I would recommend you do the same thing. Any large change you need to make to your organization, find a department that is flexible and test it on them. And what I mean by flexible is, hopefully wherever you work, you have some friends. I would recommend you test it on your friends first, because that way if it blows up and falls apart, they're not going to start screaming at you. They'll be a lot more gentle and they'll be a lot more easygoing as you make the adjustments to make things function better. Then, of course, after you've tested on your friends, you're going to refine the process and begin expanding your pool. The very last step is in every organization, there are people that either A, don't like you, or B, absolutely do not like any changes that happen. And I would recommend you save those people for dead last, if possible. The reason why you want to save those people for last is twofold. One is because you can have a very refined process and you know all the problems that can occur, and hopefully you've addressed them by the time you get to that person. So the changes you make will be a very smooth process. The other reason is if everyone else in the organization has already gone through that change that you're implementing, and their processes are now working smoothly, if you have any problems with that person, he'll have no one to complain to. Let's just call him Brian. If you know Brian's going to be a problem, save him for last. And if something doesn't go right, or if he still doesn't like the change after you've done all the other steps, Brian will have no one to complain to because everyone else has already made the change. The last step is evaluate. Obviously, you're going to want to follow up and make sure that what the change you've made is not only effective, but it's not hurting people's workflow more than necessary. Sending out surveys and metrics are a good way to measure this. Some people, if you sit down and ask them a question, will give you the answer. Some people, if they're upset, will just start, yelling it at department director meetings, and then you quickly get some feedback there. Some people are shy and polite though, and the only way you're going to get honest criticism is anonymous surveys. I honestly recommend friendship though is the best way to get good feedback. One of the parts of my job is to go around, part of my job as an IT consultant is to go around the facility and make sure people are happy and the technology needs are met. And the reason why I'm able to do that is because I have a friendly relationship with everyone in the building. And that is one of the most important parts of doing what we do. You as a compliance officer or the privacy officer, security officer, having friends and being able to sit down and have one-on-one conversations with everyone in the building or everyone in the department is one of the best ways to get feedback and to make sure that what you're trying to achieve is actually being accomplished. So the last thing I want to talk about is now that you're finally compliant, what do you do now? So let's say you've gone through all the checklists, you've done everything right. What are you supposed to do next? The first thing I want to really point out is this roadmap is aimed at checking a box to make sure that you don't get fined. After you check those boxes, your organization is now more or less safe. It's important though that you take the next step and you go from just checking a box to being fully secure. And what I mean by that is, if you have a law office that you share PHI with, you could take a flash drive, encrypt the flash drive, put the PHI on there, walk it over there, have that person take it off the flash drive, and then you can bring the flash drive back. That is technically a compliant way to share PHI with someone, but it's not probably the most secure. An upgrade to that would be potentially moving to a cloud storage solution where you could have full encryption in the cloud. You can have people with unique user IDs and passwords. You can have full auditing. You can have folder level permissions. Those are steps that you can take to transfer from just checking a box to making your organization more secure. And that's really the goal of any compliance program. It's not just being compliant, it's actually taking care of people's PHI like you would want someone else to take care of your own PHI. The other thing that's important is it's very important to stay diligent. You don't want to be that person. And what I mean by that is 10 years ago, let's just say it's Brian's job to be the HIPAA compliance officer, or maybe he's just an average person, but he's the corporate compliance officer. It was Brian's job 10 years ago to make sure that the BAAs are good to go, make sure you've done a risk assessment, make sure you've done education and audits and all these things. And Brian never did it, either because Brian was lazy, but more than likely because Brian didn't know. And Brian didn't know that Brian didn't know. And now that you've learned all these things and implemented all these changes and you've checked all these boxes and now you're compliant, it's important that 10 years from now, you're not the next Brian. You want to make sure that you find ways to continue to educate yourself, sign yourself up for newsletters, have meetings with other HIPAA-minded people so you can share information. One of the things that I really like about HIPAA Trek is we have a monthly meeting. It's called the HIPAA Huddle, and that's exactly what we do. HIPAA officers from all over the country get together and we talk about different challenges we're dealing with and we talk about how to address them. We talk about changes that are coming. And it's one of the most valuable things you can do to stay relevant in your position. The last thing that I'd recommend you do once you're compliant is to help others. In order for you to become compliant, more than likely you reached out to others and asked for help, those friendly organizations that I referred to them as. It's important now that somebody has helped you, that you in turn reach out and help others. Helping others and staying compliant It's one of the things I really enjoy about being a security officer, and it's one of the big reasons why I wanted to put on this presentation for today. So that's about 45 minutes there. That's the end of my slides. I want to thank you all for your time, and I'll turn it back over to Sarah if you guys have questions.
All right, perfect. Thank you so much, Matthew. This was incredible. So there are a couple questions that came through. So first, yes, everybody will get a copy of the presentation and a copy of the recording. Then we have a comment, when main category missing, and this was when we were talking about business associate agreements, is software vendors, practice management, EMR, portal, patient engagement, etc. And that is true. So when you are looking and doing your business associate agreement evaluations and reviewing all of them, it's really helpful to go to each department and see who are all the vendors that they're utilizing and make a list. Then establish and evaluate whether or not they are a business associate or just a vendor. And then ensure you have a business associate agreement in place for all of those folks. Next comment, Matthew, for you is, how do you evaluate the threats? So we have to map all the threats. How do we do that? It's a big question, Matthew.
Yeah, I mean, like I said, what I did is, I work really closely with Sarah and HIPAA, and they really gave us a template of how to do it. Sarah, do you want to talk a little bit more about exactly what that looks like?
Yeah, so, and I'll dig up the recording and send a link to that as well. So I did a webinar on what to expect in a risk analysis, and I'll send that information out as well. But really mapping threats is kind of like a big game of what if, right? So you have to consider all the what ifs. And so how we always like to explain all of this is like, if you think about a house, right? So the house is your organization and you're trying to assess everything, right? So a vulnerability is any weakness that could let the boogeyman, which is the threat, into your house, right? And so you have to think of all the different boogeymans that are trying to get into your house and how they can get in there. So if you have a broken lock on your door, who can exploit that, right? So what kind of person can come in through that broken lock? How can you prevent them from coming, and what kind of damage can they do, right? So when we're looking at, let's just say, so ransomware is a potential threat to your hospital, right? So how are they getting in? So what are the vulnerabilities? So they're going to get, so ransomware will be a threat for all of your employees, for email, for a weak firewall, for unpatched security programs. So you have to think about it that way. So you can have one threat that can attack you through multiple different vulnerabilities. So hopefully that answers that question. Yes, it absolutely does. Okay, thank you. Perfect. Awesome. So again, I'll be sending that I'll try to dig up that slide and get that out to you guys as well. So are there any other questions for Matthew? No, perfect. Okay, so I do want to say, so we do have our HIPAA huddle that Matthew referenced tomorrow. That is a monthly call with compliance officers from around the country. You do not have to be a HIPAA client to attend, and it is free. There is always a link to the HIPAA huddle in my email signature line. So when I'm sending out all the information from today, if you are interested in participating in the HIPAA huddle, please don't forget to register for that. It is tomorrow at 1 o'clock. Tomorrow we actually had a lot of questions on ransomware. So the entire conversation will be focused on ransomware, which is super exciting. And again, thank you so much, Matthew, and to everybody who participated. We really appreciate all of your time. All right,
yeah, no problem. Thank you.
All right, thanks. Bye, y'all.